Thanks for watching On Call for All Kids. Today we'll be talking about common pediatric rashes. We'll get questions answered about eczema, contact dermatitis, and the chicken pox, how common rashes can be treated at home, and when a rash is dangerous and could be a potential medical emergency. I'm joined by Dr. Joe Perno. He is an emergency medicine physician at Johns Hopkins All Children's Hospital. Great to see you here, Dr. Perno.
Thank you for having me.
So rashes, this is something you commonly see in the emergency center. Sometimes they can easily be treated at home, sometimes a medical emergency. Let's kind of go through some of these rashes, starting off with eczema. What is that?
So eczema is probably the most common rash that we see in the emergency department or even in a pediatrician's office. And it's, as I said, very common in children. It's a dry, scaly, itchy skin. Many babies have it. Fortunately, many kids will outgrow it. Unfortunately, some children and adults suffer the rest of their life. And it's typically an overactive immune system. We'll see it commonly related to people who have allergies or asthma. It typically can be treated by lubricating lotions and applying it right after a bath and trying to limit how many baths they take a week. When it gets very severe, sometimes we have to use steroids to control it. And sometimes it actually can become a medical emergency, really requiring an ER visit. When it becomes infected because of maybe the scratching and the open sores, it can get infected with staph and really cause a problem. So it is common for us to see these in the ER of variable degrees of severity.
What about contact dermatitis? What is that?
So that's another really common one. So that's when something comes in contact with your skin and you get a reaction. So poison ivy would be a perfect example of this. Sometimes a laundry detergent or a soap, and you'll see it usually in a localized area. It'll be red, inflamed, many times itchy, mildly painful at times. Again, the best thing you could do for this is removing whatever's causing it, if you could figure out what the substance is that's causing it. Also using antihistamines to decrease itch, and keeping the surface clean with soap and water is usually the best thing.
And what about hives? When does that turn into a potential emergency situation?
Yeah, so hives, probably of the list that we talked about, is probably the most concerning. Sometimes hives can be very benign, caused by a food or a virus even, or just an airborne substance, and you get some hives and you're itchy and you're uncomfortable and can be treated again with antihistamines. Other times, hives can progress to a full allergic reaction where you have difficulty swallowing, speaking, the child may be drooling, or worse if there's wheezing or difficulty breathing. So it's a whole spectrum, and that could be a real big emergency where you have to go directly to the ER or possibly call 911. Some people even require an epinephrine injection for the most severe of reactions, and if you have known food allergies, having that prescription, having that at home could be necessary. But most times hives can be treated with just simple antihistamines.
Now, do you see the chickenpox anymore, also known as varicella?
No, so fortunately we don't. It's very rare. The vaccine has done a job of really neutralizing that and making it almost a non-entity. We'll see it occasionally. If it does present, it's usually a little red spot with usually a fluid-filled blister on top, scattered across typically the trunk and spreading out elsewhere. But again, very rare. Sometimes we will see zoster, which is kind of a localized chickenpox reaction that can come after having the vaccine or having the disease. That tends to be a similar rash, but usually only in one area. But fortunately, both of those are very rare thanks to the vaccination that rolled out, over probably 30 years ago now.
Yeah, that's great. Are there any other types of common rashes that you see?
Yeah, probably another common one we see, especially in the summer months, is many of the viruses that cause kids to get sick, to have runny nose, cough, or fever. The summertime viruses typically will give you a red rash head to toe. The funny thing about this rash is it usually bothers the parents more than it bothers the child. It's not typically itchy or painful, but they're polka dotted head to toe. So that sometimes is alarming for the families. Most times it'll go away at the same time as the virus or the fever. One of the viruses, roseola, typically the fever goes away and then boom, the rash pops out head to toe, and then you were dealing with roseola, which is again just another common virus that we see in children.
Now, when is a rash potentially dangerous and you should get to that emergency center right away?
Yeah, so some rashes do make me scared, and you need to come see me right away. So we talked about the allergic type reactions. So those definitely, anytime there's difficulty breathing, speaking, swallowing, that's an emergency. We need to see you. If your child has a fever, red rash, head to toe, with that looks like somebody took a red magic marker and just made little dots all over them, that could be a concerning rash that we'd want to see you. It could be a problem with the platelets. If they have big purple splotches on their body that almost looks like bruising, but they weren't injured or have no bruises, and especially if that's present with fever, that could be concerning. We'd want to see you. And anytime a rash involves the mouth or the lips and you have peeling skin or sores inside the mouth or the nose, that can be an emergency. And again, we need to see you right away. And that would be go see your pediatrician or come see us in the ER immediately.
And lastly, Dr. Perno, are there any rare rashes that we should be aware of as parents?
Yeah, unfortunately, with the pandemic and COVID-19, we're seeing a syndrome, multi-inflammatory syndrome in children that presents often after a COVID exposure that can involve a red rash. It can involve peeling skin, bright red lips with peeling skin there, and it can involve some of the other symptoms, fever, vomiting, belly pain, muscle aches. So if we see anything like that, that's a go see your pediatrician or go to the emergency department immediately for further evaluation. They're very vague symptoms, but can be concerning if the child does have that syndrome.
All right, Dr. Perno, it was great to see you. Thank you for giving us all this information about rashes today. We will definitely see you next time.
Thanks for having me.
And thank you all so much for watching. Don't forget, you can check out our website. It's hopkinsallchildrens.org/newsroom, and you'll find a lot of other great resources and pediatric healthcare information there as well. We will see you next week.